This video explains the process of having awake surgery on your arm or hand. You should watch this video if you've been told that you are having surgery on your arm or your hand without a general anaesthetic. Your surgeon, anaesthetic doctor or nurse may have mentioned that you are having surgery under local anaesthetic or a nerve block or regional anaesthetic. If you have had an operation before, you are likely to have had this under general anaesthesia. Doctors and patients sometimes describe this as going to sleep. General anaesthesia is associated with certain risks and side effects. Awake surgery means having surgery without a general anaesthetic. This means that the area being operated on will be numbed with an injection of local anaesthetic in one of two places. Local anaesthetic can be injected directly in the area where you are having the surgery. This is called a local anaesthetic technique. Local anaesthetic can also be injected around the nerves supplying the area of the operation. This is known as a regional anaesthetic technique, or more commonly as a nerve block. Because the local anaesthetic has numbed the area where the operation is taking place, awake surgery does not mean being in pain during the operation or being uncomfortable during the operation. However, you are likely to remember noises and conversations around the time of the procedure and be aware of touch and pressure sensation during the procedure. You have been offered awake surgery for one or more of the following reasons. You have medical problems, which mean that a general anaesthetic is high risk. There is a faster recovery time associated with awake surgery. You have chosen to have an awake surgery. This surgery is suited to an awake technique. On the morning of surgery, you will meet with the anaesthetic doctor or surgeon performing the procedure. They will explain the benefits and risks of the specific techniques that you are having. They will also make you aware of any specific aftercare arrangements. First, you will be attached to monitoring for your blood pressure, heart rate, and oxygen levels. The anaesthetist will then place a cannula or drip in your hand. This is to maintain your safety throughout the operation. They will then position you for the injection of local anaesthetic. Commonly, this injection is in the neck or the armpit. They will ensure that you are covered at all times to protect your dignity. The anaesthetist will then clean your skin and use an ultrasound to identify the correct area for injection. A small amount of local anaesthetic is then injected under the skin. This may sting a little. The anaesthetist will then use the ultrasound to guide the needle into the correct position. This should not be painful, but it might be uncomfortable. This will be followed by a larger injection of local anaesthetic. You will feel a sensation of pressure, and some patients may experience an electric shock sensation, warmth, or tingling in the arm. It is important that you do not move during this part of the procedure. Following the local anaesthetic injection, you will be monitored closely until it is time for the operation. Before the operation, the anaesthetist and surgeon will test the area being operated on to ensure that the local anaesthetic is working. This normally takes about 20 to 30 minutes. Once the local anaesthetic is working, you will be taken to the operating theatre for your operation. When the operation is over, you will be monitored for a short time afterwards before being discharged home. Your nerve block should wear off completely within 24 hours of the initial injection. After surgery, your arm will be numb and heavy until the block wears off. you will be provided with a sling to keep it safe. You must be aware that you will be unable to feel or move the arm. Do not operate any machinery or use hot items such as when cooking. Position your arm carefully on a pillow if you take it out of the sling. Your arm should be back to normal by the morning. To manage your pain when the block wears off, take your painkillers regularly as prescribed, even if you have no pain, and especially before you go to sleep at night. Having a nerve block or regional anaesthetic technique is a safe part of routine practice. Your anaesthetist will discuss the benefits and risks with you on the day of surgery. Benefits to having a nerve block include better pain relief, a reduced need for strong painkillers, a faster recovery including leaving hospital sooner, and avoiding the risks of having a general anaesthetic. Additionally, if you have significant medical problems, then the benefits of having a nerve block are likely to outweigh the risks in the context of this type of surgery. Your anaesthetist will discuss the unintended effects and risks specific to your procedure on the morning of surgery. These can be thought of as very common, common, uncommon, rare, or very rare. A very common, unintended effect of having a nerve block is motor block. This results in a weakness and an inability to use the arm fully until the block wears off. Other common risks and unintended effects of having a nerve block include the following: pain or discomfort during the injection of local anaesthetic, bleeding or bruising over the site of injection, tingling or pins and needles in the arm, requiring a top-up of local anaesthetic before or during the operation, numbness to the other structures around the neck. This might include the skin or muscles of the face, causing a droopy eyelid, temporary nerve damage, experienced as a patch of numb or tingly skin. This resolves in 6 weeks for 95% of patients. Uncommon but significant complications of having a nerve block include permanent nerve damage, damage to other structures around the neck such as the lung, having a severe reaction to the local anaesthetic.
How long until the nerve block starts to work?
In general, you will feel the block starting to work shortly after the injection. However, it usually takes 20 to 30 minutes before it has developed sufficiently for you to have surgery. Your anaesthetist and surgeon will check this before starting the operation.
How long does the block last for?
Most blocks last between 18 to 24 hours. This means that it is likely to wear off in the evening or overnight while you are asleep.
What will I feel during surgery?
Some patients do not feel anything at all during surgery. Some patients have a sensation of light touch or pressure. You should not feel sharp pain during your operation.
Can I listen to music during surgery?
Yes, please make sure you bring your headphones and an electronic device so you can listen to music or podcasts during your operation.
What if I am uncomfortable during surgery?
If you experience sharp pain or are in an uncomfortable position, please let a member of the operating team know immediately.
Who will be looking after me?
You will always have a nurse and a surgeon looking after you before, during, and after your operation. Depending on the type of operation you are having, there may also be an anaesthetic doctor present.
What is it like when the block wears off?
The block is likely to wear off gradually, with your sensation and strength returning to the arm over a period of a few hours. It is important that you take your painkillers before this starts to happen, in order to avoid being in discomfort when the block wears off.